Okay, we're going to talk about something that is absolutely crucial for our daily comfort and our long term health. But it's a topic most of us would rather avoid. Well, today we're breaking that silence. We're going to dive into proactive anal health with some clear, practical guidance. So let's just get it out of the way. Why is this so hard to talk about? Well, yeah, there's a lot of sensitivity and stigma around anything to do with anorectal health. But the whole point of this explainer is to create a totally judgment-free zone. Because you know what? These issues are way more common than you'd think, and just understanding them is the very first step to feeling better.
And just how common are we talking about? Well, get this. Studies show that up to 18% of people experience something called functional anorectal pain. That is nearly 1 in every 5 people dealing with discomfort that really impacts their quality of life. So you are definitely not alone in this. All right, so knowing how common this is, let's get proactive. Let's focus on prevention. What are the simple daily habits we can all start doing right now to stay ahead of these problems and just build a solid foundation for better anal health? Okay, prepare to have a lifelong habit totally challenged. We're all taught that toilet paper is the answer, right? But according to proctologists, it could actually be a huge part of the problem. A lot of the time, it just gives you this false sense of being clean while actually causing a ton of irritation. Let's break this down. When you think about it, toilet paper mostly just, well, it spreads things around. And all that friction on really sensitive skin can cause tiny little micro tears and irritation. Water, on the other hand, cleans everything gently and way more effectively. It's why experts are always recommending bidets or those handheld showers. The big takeaway here, it's all about washing, not just wiping. And believe it or not, there is mechanically a better way to have a bowel movement. First off, listen to your body. When you feel the urge, go, don't put it off. Second, your posture is everything. Leaning forward helps, but the real game changer is getting a small stool to put your feet on. This simple little tweak straightens out the anorectal angle, which makes for a much smoother, less strained experience. So beyond posture, these 4 habits are really the cornerstones of prevention. And yeah, they might sound familiar, but they are absolutely critical for anal health. A diet rich in fiber, plus lots of hydration, keeps your stool soft. Regular exercise gets your digestion moving. And trying not to sit for super long periods reduces pressure on that whole area. Seriously, think of these as your daily defenses. But what happens when prevention isn't quite enough, or maybe a problem has already started? Okay, now we're going to demystify some of the most common causes of pain and discomfort, so you can get a better handle on what might actually be going on. One of the most common culprits for that sharp, severe pain is something called an anal fissure. The easiest way to think about it is like a little paper cut, but in an incredibly sensitive place. It's a tear in the anal lining, and it's usually caused by passing a hard stool. The key symptoms are that really characteristic sharp pain when you go, which can stick around for minutes or even hours, and sometimes seeing a bit of bright red blood. Now, not all pain comes from a fissure. Sometimes the issue is actually muscular or even nerve-related. Doctors call this functional anal rectal pain. And this table here breaks down the 2 main types based on what's called the Rome 4 criteria. The key thing to notice is the timing. Proctalgia fugax is this sudden, sharp, stabbing pain that's over pretty quick, usually less than 30 minutes. Levator-Ani syndrome, on the other hand, is a much longer-lasting, dull ache or pressure that can go on for more than half an hour. You know, when you're dealing with these conditions, especially if you're looking at surgery, a lot of people are really afraid of the recovery process. And that's because the pain can create this awful, self-perpetuating cycle. But the good news is, modern medicine has found really targeted ways to break this cycle and make healing a much, much more manageable process. So let's trace this vicious cycle, because understanding it is the absolute key to breaking it. It all kicks off with an initial trigger: pain. Whether it's from a fissure or from a surgical procedure, it starts with pain. And what happens when your body feels pain? Well, its protective instinct kicks in, and that causes an involuntary muscle spasm. The whole area just clenches up and tightens. But here's the problem. That tightened muscle now blocks the natural path. And that leads to difficult evacuation. It leads to constipation because our bodies are subconsciously trying to avoid that painful experience all over again. And this is where the cycle just locks itself in. The strain from that difficult evacuation causes more trauma and, you guessed it, more pain,
which in turn triggers more spasms, and the cycle just repeats over and over, turning what was an acute problem into a chronic one. So how in the world do we break out of it? Well, modern approaches target each step of that cycle directly. Anesthetic blocks can numb that initial pain. Relaxing ointments or even Botox can force the muscle spasm to release. Low-potency lasers can actually speed up healing and reduce pain. And of course, choosing minimally invasive surgery from the get-go means there's less initial trauma and pain to start with. So breaking the cycle often involves some kind of medical intervention. But the work doesn't stop there. For anyone who's recovering from a procedure, your care at home is every bit as critical as the surgery itself. Your diet is your absolute best friend during recovery. The goal here is simple. Keep your stools soft and easy to pass. That means eating a wide variety of foods with plenty of fiber. Hydration is completely non-negotiable. Eating smaller meals more often can also help, so you don't overload your system. And of course, it's a good idea to steer clear of anything that could be irritating, like really spicy or heavily processed foods. Now, this is so important. While all this information gives you a great framework, everybody's body and situation is different. This explainer is a guide. It is not a substitute for professional medical advice. The most important step you can take is to follow the specific, personalized instructions from your own doctor. Okay, so let's bring it all together. We've covered prevention, we've covered common problems, and we've covered recovery. So what are the absolute key pillars you should take away for lifelong anal health? Here it is, your simple, actionable checklist. Stay hydrated and eat fiber. Use a stool to perfect your toilet posture. Switch from toilet paper to water for cleaning. Listen to your body and don't ignore the urge to go. And finally, if you have persistent pain or any concerns at all, please talk to a specialist. Don't just suffer in silence. And that brings us to our final thought. You do not have to overhaul your entire life all at once. Looking at everything we've covered, what is just one small, manageable change you can commit to starting today? Because those small steps, those are what lead to lasting comfort and health.